as far as palpating farther down in here, let me demonstrate that because I kind of got sidetracked by going straight to the coccygeus because that's where I was. I tend to stay regional with people. So I'm going to go down now through here and then palpate and feel for muscle attachments down along on the pubic bone and see if she feels even there. I'm just going to go on one side. I'm going to keep the soft tissue out of the way. That feels just fine. A little tension right there. Do you feel that, Judith?
Yes, I do.
So I'm getting partly through some of the superficial group right here, but I'm actually heading for the pubococcygeus muscle and puborectalis. So there are strands that are going all the way up to here and strands that are going here around the rectum. And so I'm hooking a little bit underneath this bony ledge to get into here and waiting for that to soften. And I'm actually moving her labia towards the midline so that she doesn't have any feel of my going for her internal structures. You okay with that?
Yes.
Sometimes this kind of work can help with urinary urgency and a little bit with stress incontinence. This is only a very minor part of the work with female pelvic floor work and male, but it can be a very nice start. There, that's much better. How do you feel, Judith?
That feels good.
It's amazing when done right how pelvic floor work actually is a relief. If you go slowly enough and allow the releases to happen. So I am right here on her, headed for this part of the levator ani group. And there is indeed quite a restriction right there. It feels like puborectalis. Can you lift your pelvic floor up for me? Okay, and then relax. So she's using her glutes, and if I had her as a patient, I would teach her to isolate between glutes and pelvic floor.
Let me try again.
You want to try again? Okay, and then can you bulge into my finger? Bulge it down? Like push me out? There you go. And can you lift up and in? That's a little harder to do. So that's another part of pelvic floor work where a patient needs to be able to lower the pelvic floor at will and lift it at will. Quite a few pelvic floor pain patients have no ability to bulge the floor because there's so much tension holding it up and in. And incontinence patients often have the reverse, where they bulge the floor too much when they're doing bowel movements or coughing or sneezing, and they don't know how to lift it up and in. There you go. And then that's starting to let go there. So I am right in here. And I'm heading my fingers pretty much towards her head. Good job, Judith. And if you're having trouble with a muscle letting go, and it's not really, and they're uncomfortable, say, contract that muscle for me. Yeah. Can you find it? There you go. And hold it for 6 seconds. 6, 5, 4, 3, 2, 1, and then let go. And now that just softened up and I was able to go in a little bit further.
That's kind of sharpish.
Yeah, I feel that. So I'm going to gently reposition. Pelvic floor pain can feel like sandpaper. It can feel like ice picks. That's better now. How about there? So I'm angling in this way. Once again, I'm moving her labia over so that I can get into this side. Less picky or sharp?
some tension in there for sure.
I feel like a global tension, but not any one structure that's super hard. Right there. It's kind of the last of it. And try and push me out. Good. And hold it. 4, 3, 2, 1, and let go. Beautiful. And come out slowly. Thank you, Judith. So in summary, for doing the levator ani group, find the ischial tuberosities and you work your way up. And you find the ischial tuberosities and you work your way down. And it's just a matter of pressing slowly and carefully into the muscles. You can do one side at a time or both. So here we go. I'm going to go in and press. And just assess for tension. So you know where to come back to if you like. And I'm already on the coccyx right there, so it's not very high. And I can work my way back down again. And there's the ischial tuberosity right there. So I'm going to go slightly medial to it. Gently and slowly. Make sure I move the labia over. There I am. I'm on the inside here, so I'm getting the anterior attachments of the levator ani group. And I am working through the more superficial muscles of the pelvic diaphragm here.